just because I have so much to cover. So good morning, everyone. Happy Friday. Thank you for joining us for our Key Findings webinar. My name is Tim Diamede, and I've had the privilege of serving as the coordinator and chair of the Maine State Epidemiological Outcomes Workgroup for the past 10 years, believe it or not. Today, I will be presenting an overview of our soon-to-be published 2021 State Substance Use Trends Report. As for the agenda, first I'll just give a brief introduction to the SEOW regarding the purpose and objectives of the workgroup. Then I'll go ahead and present the key findings of this year's report. And as with all of our resources, or most of our resources, the presentation is going to be organized by the 3 C's. Consumption, consequences, and contributing factors of substance use. In addition, we'll take a look at a few indicators regarding mental health. So this particular webinar will only be focused on state level data. And just before we begin, just for a little housekeeping, instead of introducing everyone on the call, please put your name and organization in the chat if you don't mind. In order to limit background noise, I have placed everybody on mute. And to ensure that we cover all the content in today's presentation, we're going to try to hold off on questions and open up for discussion at the end of the presentation. But please feel free to put a question in the chat. That way you won't forget. And just as a reminder, all SEOW webinars are recorded for future reference. And a link to today's webinar recording, as well as a PDF version of the presentation, will be posted on our website. Okay, let's go ahead and start the show here. So the SEOW serves as a clearinghouse for substance use and mental health related data indicators. Maine SEOW was actually started way back in 2005. The SEOW was funded under a SAMHSA grant called Partnerships for Success, where the primary focus of the grant was to prevent substance use among 12 to 25-year-olds. That grant ended, and we are now currently funded by a combination of funding streams under the Maine CDC. So here are our major objectives. First of all, the workgroup is here to promote systematic data-driven decision-making. We're here to identify and track emerging substances and patterns over time. Our work helps to guide effective and efficient use of prevention resources. We also help the state and communities to assess, plan, and evaluate. And lastly, we're here to provide an opportunity for networking and collaboration among data gatekeepers and like-minded stakeholders. So, when tracking substance use trends in Maine, the SEOW uses what's called a triangulation approach. We all know that data sources have limitations, therefore we shouldn't rely too heavily on a single indicator or a single source of information. That's why it's so important for us to consult a multitude and variety of sources to give us a fuller picture and a more comprehensive view at the issue at hand. So this approach can help us to enrich, refute, confirm, and sometimes even explain a pattern or emerging issue. So the first part of the presentation will cover consumption, or sometimes called prevalence data. Most often we use data from self-reported surveys, and in the prevention world, these data or these measures often are outcome measures in which we're trying to move the needle. But before I dive in, I did have a few notes I wanted to share. So due to COVID, our beloved Maine Integrated Youth Health Survey was postponed this year. So instead of being administered in the spring of 2021, it was given to students this fall. And it actually might be in the field right now as well. I'd have to double check with our coordinator. So we do look forward to having results sometime next summer, fall. In addition, the Behavioral Risk Factor Surveillance System, BRIEFIS, that data set was also delayed. We just received 2018 BRIEFIS data set and anticipate receiving 2019 data in the spring. So due to some of these challenges, so these aren't all the challenges for data as you can imagine. But due to some of these survey challenges, we are relying more heavily on the National Survey of Drug Use and Health. And I'll refer to that as NSDA here on out. But we are told that the upcoming 2019-20 estimates should not be trended with previous years due to changes in how it was administered. So needless to say, we're working with the resources that we have. Okay, as for the data, so starting on a positive note, as you all know, based on MIAS data, past month alcohol use among Maine high school students has declined by 28% since 2009. So great job, prevention field. And in 2019, about 1 in 4 students reported drinking in the past month. And out of those students who did drink in the past month, about 1 in 3 reported binge drinking. Binge drinking continues to be most prevalent among our young adults, 18 to 24, 18 to 25, with about 1 in 4 reporting this behavior in the past month. Based on self-reported consumption data, 11% or 13,000 young adults, 18 to 25, qualified as having an alcohol use disorder. And this is compared to 2% among those 12 to 17. According to PRAMS, the Pregnancy Risk Assessment Monitoring System, in 2019, about 1 in 10 women reported drinking alcohol during their last trimester. And this was a slight increase from 2018. So this map shows us that a higher percentage of Mainers 12 to 20 reported alcohol use in the past month compared to the US. So 22% versus about 19%. And rates of underage alcohol use appear to be higher across the northern part of the country. So this slide focuses on trends regarding tobacco and electronic vaping. The good news is that cigarette use among youth and young adults has been decreasing over the past several years. So prevention and public health efforts have paid off. However, rates do remain somewhat stagnant among older age groups. The not so good news is that we're seeing a major shift to electronic vapor product use. Rates among high school students have observed a dramatic increase, nearly doubling in recent years. E-cigarette use has surpassed traditional cigarette use among adult Mainers, with about 1 in 5 reporting as current users. In 2019, a little over 1 in 10 women in Maine reported smoking cigarettes in their last trimester. Fortunately, rates have been declining for the past 5 years. Cigarette use among pregnant women appears to be higher among women 20 to 24, as well as those with lower levels of education. This slide illustrates the steady decline we have been observing in tobacco use among high school students over the past several years. Rates of both past month cigarette use as well as cigar use have been cut in half since 2011. And as I previously mentioned, while we have observed a steady decrease in cigarette use among our younger adults, rates have plateaued among older Mainers. And it's also worth noting, and kind of tough to believe, that 1 in 4 Mainers ages 25 to 44 are current smokers. In 2019, nearly half of high school students in Maine reported having ever used an electronic vaping product. This represents a 24% increase from 2017. And in 2019, nearly 1/3, as I mentioned, of high schoolers reported using an electronic vapor product in the past month. And the rate nearly doubled from 2017. So in terms of marijuana consumption patterns, the latest data available tells us that about 1/5 of high school students used marijuana in the past month, and rates have been consistent over time. We also know that use among students increased this with advancement of grade. So rates nearly triple from 8th grade at 5% to 9th grade at 13%. And then they actually, although it's not shown, they actually go up to, I think, 29% in 12th grade. Probably no surprise that our young adults have the highest rates of use within our state, with more than a third reporting that they had used marijuana in the past month. In 2019, nearly 17,000 Mainers reported using marijuana for the first time in their life. The number of first-time users between 12 and 17 increased by 20% in recent years. Vaping marijuana also has been gaining in popularity. Of students who had ever vaped, 13% reported that the last time they had vaped, the liquid was a marijuana-based oil. And perhaps more unsettling, 7% weren't quite certain what they had vaped. And in 2019, about 1 in 10 women who had recently given birth reported using marijuana during their 3rd trimester. And rates have remained relatively stable over the past several years. And here's how we compare to the rest of the nation regarding marijuana use among our young adults. The latest estimates show Maine observing a rate that is 50% higher than the nation. So Maine has a 35% versus the nation at 23%. And we actually had the highest, second highest to Vermont. And rates appear to be higher in the Northeast, West Coast, and Southwest region of the country. And here's that same indicator, but trending over the past couple decades. And we can see that Maine really started to break from the national trend right around 2012. Okay, moving on to opioids and illicit drug patterns. So based on self-reported data, around 46,000 Mainers misused pain relievers in the past year. 7,000 used heroin in the past year, and 42,000 qualified as having an illicit drug use disorder. In 2019, 5% of high school students misused any type of prescription drugs in the past month, and about 1 in 10 reported ever misusing a pain reliever, according to NISDA. Excuse me, according to NISDA, rates of past year pain reliever misuse is most common among young adults, probably not a big surprise. And in 2019, 7% of high school students reported having ever used heroin. Rates have been cut in half since 2009, fortunately. And rates do appear to be higher among certain minority populations, such as students who identify as Hispanic, Black, American Indian, or LGBTQ. As far as stimulant consumption patterns, around 23,000 Mainers reported using cocaine in the past year, and about 6,000 reported using methamphetamine in the past year. And numbers have increased over time. About 4% of high school students reported ever using cocaine or MDMA. 3% reported ever using methamphetamine. And use appears to be higher among minority high school students, such as those who identify as LGBTQ, Black, and Native Hawaiian or Pacific Islander. 2019, young adult Mainers 18 to 25 had higher rates of past year cocaine use at 7.3% than the national average at 5.5%. Rates of cocaine use among our young adults have increased since 2013-14, when it was around 4.5%. And here's a trend of Maine high school students reporting drug use in their lifetime by drug type. And we can see that rates of inhalants, cocaine, heroin, methamphetamine, and MDMA have decreased over time, but appear to have plateaued in recent years. All right, we're gonna pause for a little quiz. So, question is, what percentage of young adults 18 to 25 in Maine qualified as having an alcohol use disorder in 2018-19? Give it a few more seconds. This is fun. I always wanted my own game show. All right, I'm going to end the poll. And almost half of you said 11%. And that is the correct answer. Gold star, guys. All right, the next section we're going to cover data related to the consequences of substance use in Maine. So, for morbidity and mortality, according to Maine's syndromic surveillance system, there were over 27,000 substance use related emergency department visits in 2020 in Maine. 19,600 visits were related to alcohol, 5,600 were related to marijuana use, and nearly 1,500 were related to opioid use. Non-pharmaceutical fentanyl is still the major driver in drug-related deaths and was found in 67% of overdose deaths in Maine. The majority of drug overdose deaths occur among Mainers between 26 and 49 and males. Illicit stimulant drugs, which are often combined with illicit fentanyl, are an emerging cause of concern due to their increased involvement in drug deaths. The number of deaths related to methamphetamine doubled between 2019 to 2020, while deaths involving cocaine have nearly doubled since 2016. And about 1 in 4 deaths involved cocaine in 2020. So from 2019 to 2020, there was a 5% increase in alcohol-related emergency department visits, a 23% increase in marijuana-related visits, and an 18% increase in opioid-related visits. Although not shown, in 2020, males had twice as many alcohol-related ED visits, and rates were highest among Mainers between 36 and 54. In 2020, there were a total of 504 overdose drug deaths in Maine, and this represented a 33% increase from 2019. From 2016 to 2020, drug overdose deaths involving non-pharmaceutical fentanyl increased by a whopping 73%. Deaths involving methamphetamine increased 13-fold, and deaths involving cocaine increased by 83%. Also worth noting that in 2020, about 1/5 of deaths involved alcohol. And as an additional note, this indicator only reflects deaths where at least one drug was involved or detected. It does not include deaths caused by alcohol poisoning or prolonged alcohol use. So based on data from the Vital Stats Office, so this is different than the Chief Medical Examiner data. In 2020, there were a total of 584 Mainers who died from a cause directly related to alcohol. This was a 28% increase since 2019 and a 72% increase since 2015. Deaths related to alcoholic cirrhosis and liver disease increased among men from 2019 at 13.7 deaths per 100,000 to 20.2 deaths per 100,000 in 2020. And women also saw an increase of 1.5 more deaths per 100,000 from 2019 to 2020. And according to the Maine Automated Child Welfare Information System, MACWIS, after a decline from 2016 to 2019, the number of substance-exposed infants notifications increased by 5%, from 858 notifications in 2019 to 903 notifications in 2020. And this accounted for about 8% of the live births in Maine. It's important to add that notifications include instances where a mother is taking a legally prescribed medication such as Suboxone. So this is the first time we've been provided data that allows us to drill down further regarding the primary substance involved in substance-exposed infant notifications. So based on a combination of 2 years of data, among notifications that had a primary substance listed, over half, 53%, were related to marijuana, 1/4 involved buprenorphine, 6% were related to methadone, 3% involved heroin, and 3% were related to prescription opioids. According to the Department of Public Safety in Maine, OUI arrests in Maine have been relatively stable for the past several years and are most common among Mainers 21 to 29. Since 2015, we've observed a steady decline in arrests related to liquor law violations. In particular, youth under 18 saw a decline of nearly 50%. And after observing a major decrease in drug offense arrests for adults between 2015 to 2017, numbers have begun to increase from 2017 to 2019. About 1 in 3 drug arrests for possession were related to marijuana, and another third were categorized as dangerous non-narcotics. Now, that's an extremely broad category that includes, but is not limited to, benzodiazepines, stimulants, synthetic cannabis, bath salts, methamphetamine, hallucinogen, and barbiturates. From 2018 to 2019, arrests for possession of opium, cocaine, and derivatives increased by 1/3, while marijuana arrests continued to decline. In recent years, methamphetamine manufacturing investigations conducted by the Maine Drug Enforcement Agency decreased by 72%, while investigations related to meth sales doubled. So we can see that shift. And this is most likely, we're told, due to an influx of mass-produced crystal meth into Maine. So among children who were taken into custody as a result of parental substance use, 416 total in 2019, 42% of cases were related to opioid use, illicit or non-illicit. 25% were due to stimulants, 18% were related to alcohol, and 8% were due to marijuana. In 2020, there were about 1,265 motor vehicle crashes that involved the driver that was impaired by alcohol or drugs. From 2019 to 2020, while the number of total motor vehicle crashes decreased by 20% between 2019 and 2020, the proportion of impaired crashes remained consistent at 4%. Rates of impaired crashes were highest among drivers 21 to 24, and the rate of crashes among this age group increased from 2019 to 2020. And about 1 in 4, 27% of fatal motor vehicle crashes involved a driver with a blood alcohol concentration of 0.08 or higher. From 2019 to 2020, total crash fatalities increased by 4%, and alcohol related crash fatalities increased by 5%. All right, time for another pop quiz. So, about how many emergency department visits were related to marijuana in 2020? Okay, I'm going to go ahead and in the poll. So the answer is 5,625. 20% of you guys got it right. Alrighty, that's fun. Okay, on with the show. All right, the next several slides we'll be looking at contributing factors of substance use. In particular, the next couple slides we're going to look at indicators related to supply, availability, and potential diversion of drugs and alcohol. So from 2017 to 2020, the number of prescriptions prescribed for opiate agonists decreased by 1/3, while prescriptions for buprenorphine doubled. The majority of calls to Northern New England Poison Center requesting medication verification involved opioids, followed by benzodiazepines and stimulants. In 2020, Maine had nearly 3,500 alcohol retail outlets in operation. This accounted for 26 outlets per every 10,000 Mainers. And agent spirit sales, hard liquor, in Maine increased by 10% from 2019 to 2020. And as of October 2020, active marijuana retail license holders were permitted to engage in sales to consumers ages 21 and older. Retail sales of adult use marijuana yielded $61 million in the first 12 months. So from 2017 to 2020, the number of prescriptions dispensed for opiate agonists, so this includes partial agonists such as buprenorphine, decreased by 32%. The number of prescriptions for sedatives decreased by 21%, while prescriptions dispensed for stimulants decreased by 1%. From 2015 to 2020, when we look at prescription opiates by primary ingredient, prescriptions for methadone decreased by 72%, hydrocodone prescriptions decreased by 53%, oxycodone by 47%, tramadol by 44%, while buprenorphine increased by 113%. So as of, I think it was May 2020, the last time I pulled this data. So it's changed since then. As of 2020, we had around, as I said, 3,500 alcohol retail outlets. 35 were off-premise, meaning convenience stores, gas stations. 65% were on-premise, like restaurants and bars. We had 143 brewery locations, 60 winery locations, and 26 distillery locations. And according to the Maine Bureau of Alcohol Beverages and Lottery, agent sales of spirits to off-premise outlets in Maine have never been higher. Agent spirit sales in Maine increased by 1/3 since 2016. Retail sales of adult use marijuana increased by tenfold from since inception in October 2020, from 1 million that month to 10 million in August of 2021. So social access continues to be a primary way that underage youth obtain alcohol. Of those students who obtain alcohol, about 1 in 3 reported that someone had given it to them. Just over half of parents thought their teen would not be able to access any substances at home without their knowledge. And about 1 in 3 of parents felt their child could access alcohol at home without permission. That's according to the parent survey. And over half of high school students believe that marijuana is relatively easy to get. And this rate has actually steadily declined from 2009 to 2017, but increased slightly in 2019. And here we have the percentage of Maine high school students who felt it would be easy to obtain a substance by that substance type. And we can see that perception of access to drugs and alcohol among high school students has decreased over time, but has plateaued in recent years. So according to the Maine Integrated Youth Health Survey, again, it's older data and we look forward to new data. Of high school students who thought alcohol was not easy to obtain, they were nearly 4 times less likely to drink alcohol within the past month. Those who thought marijuana was not easy to get were 9 times less likely to use in the past 30 days. And those who thought prescription drugs were not easy to get were 4 times less likely to have ever misused prescription pain relievers. Here we have perception of harm of substance use among Maine high school students by substance type and frequency. And we can see that perception of harm from weekly binge drinking, daily drinking, and any prescription drug misuse have remained stable over the past several years, while perceptions related to marijuana have progressively declined. This map is looking at perceptions of great risk from having 5 or more drinks, so binge drinking once or twice a week among 18 to 25-year-olds. And so darker shades mean lower perceptions of harm. Maine has 31% compared to the nation at 38%. And you can see that the Northeast and across the northern part of the country have lower perceptions of harm around binge drinking. This map is, again, looking at young adults, and this time it's perceptions of risk from cocaine use, at least once a month. And Maine's percentage is 58 versus the nation at 63. And again, rates seem to be lowest, which isn't a great thing, across the northern part of the country. Then the last indicator I wanted to share in this section supports the notion that there's a strong correlation between parental monitoring and substance use. Youth who think their parents do not know where they are when they're not at school were more than 5 times as likely to have misused prescription drugs, nearly 4 times as likely to have smoked cigarettes, twice as likely to drink alcohol in the past month, and twice as likely to use marijuana in the past month. All right, we got another quiz here. So the question is, of Maine parents surveyed, what percentage reported that they thought it would be harmful if their child used marijuana once or twice per week? And the polls share the results here. Okay, so it looks like most of you felt, or a third, 36%, 82% of parents. And the correct answer is 52%. So only half of parents reported that they thought it would be harmful if their child used marijuana once or twice per week. All right, as promised, I did want to cover a few mental health indicators. So more than 1 in 5 adults in Maine reported experiencing any mental illness in the past year. Young adults 18 to 25 observed the highest rate at 32%. And increases can be observed across all age groups. Rates appear to be higher in Maine and as well as the Northeast. 1 in 3 high school students reported feeling sad or helpless for at least 2 weeks in the past year. Rates have increased by 45% since 2011. About 1 in 4 adults in Maine reported having ever been diagnosed with depression, compared to about 1 in 5 reporting that they had ever been diagnosed with anxiety. And rates of anxiety appeared to be highest among Mainers 26 to 35. A map of major depressive episodes in the past year among young adults. And Maine is at 16.3% compared to the nation at 14.5%. So not a huge difference, but those rates are increasing. So in 2020, there were 240 suicides in Maine, and this was down 11% from 2019. And rates were shown to be disproportionately higher among Mainers 26 to 49 and males in general. About 1 in 7 high school students in Maine have seriously considered suicide in the past year. A little more than 1 in 10 had planned a suicide. And rates have remained relatively stable. Students who had reported that they attempted suicide increased from 2017 to 2019. In 2019, the percentage of high school students who had consumed alcohol in the past month and also had serious thoughts of suicide within the past year continued to be about 1 in 4, 26%. And this is double the rate compared to students who did not drink. Here's a map of 18 to 25-year-olds that had serious thoughts of suicide in the past year. It Maine's at 14% compared to the nation at 11.4%. And this is the trend of that indicator. So we can see over time, both Maine and the United States as a whole have been increasing in serious thoughts of suicide among young adults. All right, in summary. So when all is said and done, alcohol is still the substance of choice among Mainers. Risky use continues to have a detrimental impact on the health, safety, and well-being of our communities. We know that binge drinking and heavy drinking remain higher among our younger adults. Rising rates of use among pregnant women are also a particular concern. And we already knew alcohol use was a problem, and now we know COVID has made the situation worse. Preliminary data demonstrate increased daily and risky alcohol use, increased rates in alcohol-related injuries, and increased availability. While great progress has been made in decreasing tobacco use, there has been a swift shift to electronic vapor products across all ages. Marijuana use rates have been steadily increasing over the past several years among adults, and Maine has some of the highest rates of use in the nation. Numbers of new users have increased among youth 12 to 17 And marijuana vaping and concentrate products are gaining in popularity. We know that Maine's laws and regulations regarding medicinal and adult use of marijuana continue to impact demand, availability, perceptions of risk, and cultural norms in general. As mentioned, non-pharmaceutical fentanyl continues to play a major role in drug-related deaths. Cocaine and methamphetamine are increasingly prevalent in overdose deaths as well. And the majority of drug deaths involve multiple substances, so polysubstance use. In terms of availability, we know prescriptions for pain-relieving opiates have decreased substantially in recent years. And the majority of calls to the poison center are for opioids, benzodiazepines, and stimulants. Rates of non-medical prescription drug misuse have been decreasing in recent years among Mainers. However, illicit drug use such as cocaine, heroin, methamphetamine appear to be on the rise. In fact, Maine has some of the highest rates of young adult cocaine use in the nation, as we saw. And among students, stimulant use appears to be higher among particular minority students. And as we are all aware, substance use and mental health issues often accompany one another. Unfortunately, we're observing alarming increases in rates of depression, anxiety, and suicide ideation among our youth and young adults. Maine continues to have a higher than the national average for major depressive episodes among adults. Patterns of mental health and substance use among young adults need to be monitored more closely, as this is a demographic, 18 to 25-year-olds, that we know that's a demographic prone to risky behaviors and emotional distress. And as the COVID-19 pandemic has caused increased stress for individuals and families, it's essential that prevention professionals continue to integrate mental health promotion with substance use prevention. There is strong evidence that protective factors such as adequate sleep, family and social supports, and stable housing are all closely linked to lower rates of substance use and mental health issues among youth. Prevention strategies that target relationships between parents and caregivers and youth may be a fundamental way of preventing substance use and reducing the risk of mental health issues. Now, more than ever, Maine must focus on upstream primary prevention efforts to increase supports across families, schools, and communities. So in conclusion, the COVID-19 pandemic has delayed access to services, increased isolation, and limited supportive resources. Inevitably, substance use and mental health issues have been exacerbated. COVID has already and will continue to change how we track and monitor data. It's caused delays in altered data collection methodology indefinitely. And as mentioned at the top of the presentation, it's really important that we take a triangulation approach, utilizing a multitude of data sources. And this will always help us to get a fuller picture and more comprehensive view of the issue at hand. Based on the data, strategic planning and interventions should address factors that target multiple shared risk and protective factors related to substance use as well as mental health. As effects of COVID-19 keep unfolding and as new data is available, there will be opportunities to learn which populations have been impacted most. As we go forward, it's crucial that we continue to prioritize and invest in public health surveillance, and particularly among Mainers who are most vulnerable. And to conclude the data presentation with this quote, "No man is an island entire of itself. Every man is a piece of the continent and a part of the Maine." Just stressing the importance of aligning and leveraging efforts and taking a unified approach towards this. So before I open up for questions, I just wanted to put in a quick plug for some SEOW resources. If you haven't had a chance, please check out our new and improved website. We put a lot of hard work into it. We built some new dashboards using Tableau. And check it out and tell us what you think. There is a feedback button there. And be on the lookout for the 2021 SEOW State Profile. That should be out any day now, as well as some fact sheets are coming out as well. Just being reviewed and should be approved very soon. So with that, we can open up for questions. I know I covered a lot, and this was actually an abridged version. The published version will have about 20 to 30 bonus slides for you. And I will explore the chat right now that I've got some time. We'll work our way backwards here. Okay, is buprenorphine being prescribed for pain in addition to medication-assisted addiction recovery? Not to my knowledge. I think buprenorphine is mostly prescribed for MAT. I could be wrong, so we'll have to double check that. Yes, slides will be available. Let's see, any other questions that I'm missing here? And I think Doreen wanted to know if we're going to look at it in the workplace. Well, there was an evaluation of data and substance use in the workplace, so I do want to help disseminate the results of that, and I do want to work closer with the Maine Department of Labor as well, and see what else we can poke around and get from them. There's some urine screening data out there that is interesting too. Nationally, they are seeing increased rates of positive urine screening for stimulants, methamphetamine and cocaine in particular. What are some reasons for Maine being in the top for almost everything as opposed to the southern states? I can't speculate just or at the moment, but yeah, that's a good observation. It's cold and dark up here. It's dark at 4 o'clock. Surprising to see how reduced prescriptions for opioid pain relief was compared to the rise in buprenorphine. Yeah, I agree. And in the bonus slides, I do have some data regarding pickups of the sedatives as well as stimulants that might interest some of you as well. Other questions before we all sign off? And I'm always happy to chat anytime over the phone, old-fashioned or virtually, about any concerns or data that you're looking for. Always help to, I like to connect you to data gatekeepers. That's part of the job. Okay, well, that concludes today's webinar. I'd like to give my sincere gratitude to all participants for joining us and also for your tremendous contributions to the field. And as a reminder, today's call has been recorded and will be posted along with a PDF on our website. As always, we appreciate your feedback and hope that you'll join us for more webinars in the future. So stay well and have a wonderful and safe weekend. Happy Thanksgiving, guys.